Okay, hi everyone. Thank you for inviting me to speak today. My name is Elizabeth Humphries and I'm from Cancer Council New South Wales, as Ruth said. A little while ago, Cancer Council undertook a national evaluation of our patient information booklets, and today I want to share some of the results of that evaluation with you. Okay, but just to start off, why do we need patient information anyway? Well, advances in diagnosis and treatment of cancer mean that people with a diagnosis, as well as all of the people around them, their carers, their family, their partners, are dealing not only with the impacts of the disease itself, but also with a range of complex decisions that require some understanding of cancer treatments, and of the ongoing management of the disease. We know from research that most people affected by cancer, though not all, want to be informed about their situation and want to receive as much information as possible. Information about their cancer type, about treatments, side effects and psychosocial issues is particularly highly valued. However, we also know from research that these information needs often go unmet by the healthcare system, and people turn to other sources of information to supplement what they've been told by their healthcare teams, and sources such as written material, the internet and cancer organisations. So in response to this, Cancer Council produces a wide range of information booklets for people affected by cancer in a series called Understanding Cancer, which some of you may be familiar with. So the Understanding Cancer series encompasses more than 50 booklets, as well as some fact sheets and other resources, and focuses on 3 core domains. So types of cancer, so bowel, melanoma, lung, bladder, ovarian, treatments such as radiotherapy, chemotherapy, surgery, and psychosocial issues, so emotions and cancer, nutrition, sexuality, caring for someone, finances, the whole gamut. The booklets aim to provide easy to understand, evidence-based, current, credible information. And to achieve this, the booklets are produced by a team of professional editors and designers, and the development process involves external review of each booklet by a panel of clinicians with expertise relevant to that particular topic. We also involve consumers in our review process. And the booklet content is updated every 2 to 3 years. Okay, so we've been producing this information for people affected by cancer for many years, and the series is now quite extensive. In recent years, the series has become national, produced by a New South Wales-based team on behalf of all state and territory cancer councils, which distribute them all around Australia. The feedback that we get and the high circulation figures suggest that the booklets are well received by both consumers and healthcare professionals, but we did want to verify that the booklets were actually achieving their objectives, particularly in terms of the usefulness of the information, how easy it is to read and understand, and what people do as a result of reading the booklet. And to do this, we developed a self-report survey that was initially piloted in the Understanding Radiotherapy booklet. The survey was then extended to include 5 more titles: chemotherapy, bowel cancer, melanoma, nutrition and cancer, and emotions and cancer. It asked some demographic questions, including whether the reader had a current diagnosis, or whether they were a carer, or a survivor, or a family member, their age, gender and postcode. It explored how and when the information was received, asked readers how useful they found the information and whether it would actually increase their knowledge, whether the language used was appropriate and easily understood, and what actions the readers took as a result of reading the booklet. And we received nearly 500 surveys back. They're actually still trickling in. So the results I'm going to share with you are based on that number. Okay. So who is actually receiving and reading these booklets? Well, most people identified as having a current cancer diagnosis, slightly higher percentage of males than females. 8% had a previous diagnosis and had finished active treatment, 7% were carers, and the remainder were family members of somebody with a current diagnosis. The majority of people who returned the survey... Sorry, it's not being very responsive. Sorry, my arrows aren't working.
This will be the blind leading the blind.
Oh, sorry. I've been using it. Thank you. Magic. So, sorry. The majority of people who returned a survey were female, about 65%, And most readers, about 64%, were mature adults, so in the 40 to 69 age bracket. And that was followed by older adults at 31%. And there are a small number of younger adults, which we defined as under 39 years. Around a third of readers had completed a university degree or postgraduate qualification, and a larger proportion had a trade or vocation. And 42% were from New South Wales or the ACT, and around 60% were in a metro area. Okay. In terms of how they actually got the information, 77% of respondents had read a tumour or treatment booklet, and the remainder had read one of the psychosocial titles. Around half said it was their only source of information. 63% reported reading the whole book, with a further 28% reading most of it. And that links back to other research that indicates that people tend to self-select the amount of information that they need. So in terms of how they actually got hold of the booklet, 69% of people received the booklet directly from a healthcare professional, and that was actually slightly higher in Tasmania, Northern Territory and Queensland. Around half received it at the time of diagnosis and around half during their treatment, which makes sense in terms of the titles. And 86% agreed that they received it at the most appropriate time for them. There were some small differences in how the groups sourced the booklet, so 72% of patients received it from a healthcare professional, compared with 57% of carers and 48% of family members getting it from a healthcare professional. And perhaps not surprisingly, more carers and family members than patients and survivors sourced the booklet from a display stand or unit or an information centre within a hospital. And for us, this really underscores the importance of the healthcare professional as a source of information, but also the need for us to provide multiple ways to access these booklets so that groups who may not have as much contact with healthcare professionals can also obtain the information that they need. Okay, so in the next slides, when I talk about the percentage of readers who agreed, I'm actually referring to the aggregate of agreed and strongly agreed responses. So more than 90% of readers agreed, with 73% strongly agreeing, that the booklet contained information that was useful to them and provided a good introduction to the topic. More than 90% also agreed or strongly agreed that they could relate to the language that was used in the booklets and that the booklets were easy to understand. Interestingly, there were no differences based on education level or sex or type of reader, which suggests that the booklets are pitched at a good level that most people can relate to. We try to write our booklets for a reading age of 11 to 13 years, although sometimes the medical terminology tends to bump that up a little bit. There were also no differences in the data based on the type of booklet that they read or their location, so whether they were in a city or a regional area. Only 44% of younger adults agreed that the booklets helped them understand the info that the doctor had already provided, compared with 86% in the 40 to 69-year-old age bracket and 90% of people aged more than 70. So we wanted to understand what the outcomes of reading the book were in terms of the gains in knowledge and understanding. There was a slight variation to the questions that were used between the tumour and treatment books and the psychosocial booklets, so I'll discuss each of them separately. Looking first at the tumour and treatment booklets, more than 80% gained knowledge about cancer and treatments, with 70% strongly agreeing. More than 80% reported that they learned ways to manage side effects, and more than 80% reported that reading the booklet helped them to understand what their doctor had already told them. So there's a real role for the booklets in making information that's often received at a time of high anxiety easier to grasp and understand. There were some age-related differences here. Younger adults were significantly less likely to agree that the booklets led to an increase in their understanding, 44% versus 89% of mature adults and 81% of those aged over 70. Okay. And in terms of the psychosocial booklets, over 85% agreed that it helped them think of ways to help themselves and to manage cancer in their everyday lives, with 62% strongly agreeing. And for all types of booklets, so tumour, treatment and psychosocial, more than 80% agreed that the booklets gave them ideas about where to get further help and helped them to think of questions to ask their doctor In each of the booklets we actually include a checklist of questions just to help prompt people to think of the questions they might like to ask. So some differences based on reader type here: slightly more carers agreed compared to other groups. 87% of carers agreeing with people with a previous diagnosis, 79%, and current patients 81%. So next we actually want to find out what people did once they'd read the booklet and gained all that new knowledge. So as a result of reading the booklet, we found that around 55% of people took a specific action to speak to someone in their healthcare team about a question or the concern that they might have had. And that suggests that the booklets are helping people to clarify and gather their thoughts and provide a prompt for conversations with their healthcare team that might not otherwise have come about. 22% went out and found another Understanding Cancer booklet. We've obviously got lots of cross-references to the series in the booklet. 13% of readers reported that they rang the Cancer Council 13 11 20 telephone service to speak with one of the oncology professionals there. And 11% used another service, so counselling, home help, support groups, that kind of thing. There were some differences in the health-seeking behaviour noted. Current patients, carers and survivors were more likely to speak to a healthcare professional. More females than males called the 13 11 20 service, and people reading the psychosocial titles were also more likely to call that service. And again, more females than males sought booklets. On average, each book... We were also very interested in how the booklets were shared and discussed with family and friends, and the results of this actually surprised us a little bit. So just under 12% of readers didn't share or discuss the booklet with anyone, and the reason that they gave were varied. So some thought that cancer was a private matter, or that there was no need to discuss it, or that they or their family were just too distressed to talk about it, or some people just didn't want to bother other people. And there was a cohort as well that just said that they had no one to share it with. But that means that nearly 90% of readers did share or discuss the booklet with others. 8 in 10 said that the booklet helped them explain things to other people, and this was done through either physically giving the booklet to someone else or discussing the content with them. So in terms of sharing the booklet, half shared the booklet with their partner, and interestingly more men than women shared it with their partner. Family members were the least likely group to share with their partner. A third shared the booklet with family. More women than men shared it with family. And 1 in 10 shared it with friends, and that tended to be more the survivor group. But interestingly, on average, each booklet was physically shared with 3 other people. So for every 100 books distributed, the readership was 400 people. And of those who didn't physically share the booklet, a quarter indicated that although they didn't hand the book to somebody else to read, they did talk about it with other people. And of those who discussed the content, they were discussing it with an average of 4 other people. So if every 100 books distributed, approximately 800 people are impacted by the information. In New South Wales alone, Cancer Council distributes around 200,000 books each year. Okay. So in summary, we know that credible patient health information is an essential part of cancer care. This evaluation indicates that these Cancer Council publications are an effective tool for meeting the need for useful and understandable information among people affected by cancer. By reading the booklets, people increase their knowledge about cancer, treatments and cancer-related topics. And importantly, many were also prompted to further help-seeking behaviours and were better informed about where to access help and services. And finally, the evaluation also demonstrated that the books provide a platform for improved communication and understanding between patients and the people around them. And I'd just like to thank my colleague Angela Pearce and her team who designed and managed the evaluation and analysed the results, and my colleagues in Cancer Councils around Australia. Thank you.